Hello, Dr. Bob here. Well, it's a big day. I'm going to get started. I'm going to try to cover my entire health and wellness expanse of knowledge and provide it to, well, first off, I hope my patient population and anybody else that wants to listen, anybody that's got the time to listen to somebody who's tedious and long-winded, because I'm very thorough. If you remember, if you listen to my last video where I recapped COVID and my general sense of what COVID was all about and kind of like an amalgamation of what I think is the truth, I pointed out a little bit about my favorite song and the proverbs contained within that. And one of those is, go to work, do your best. And for a subject as deep as I'm going to cover, which is essentially trying to make you guys understand chronic disease and why we get it, you got to know the enemy. Try to get you to understand how nutrition is the most modifiable risk factor, exercise and the importance and strategies, the importance of optimizing hormones to youthful levels, the keys to supplementation, which, despite the denial in the disease model of medicine, are beneficial and helpful and can make a huge impact on your health. And then, hopefully, I'm saving it for the end, I'm going to convince you how well it works by teaching you all about me, what I've learned about myself through digging in depth into my health in a proactive, highly investigative fashion, demonstrating that despite the fact that I have genetic risks for obesity, diabetes, cardiac disease, I demonstrate none of those markers. I maintain ideal body weight. I eat a nutrition plan that I enjoy. I manage to be at a weight that is comfortable and feels good, cosmetically pretty pleasing, without really being hungry. I exercise painfully, but briefly, 2.5, 3 hours a week during my good training periods. I take a bunch of supplements. I got pill fatigue, but I do it. I'm hormone optimized, but to youthful levels, not to extreme levels like a bodybuilder would use. And I'm successful, and I've demonstrated similar successes with patients, some of which are substantially more challenged than me, and I'll share some of that with you. But it's a long road to hoe, and if you ain't got the time, shut off your device now, because I'm not going to be quick about it, okay? I told you, go to work, do your best. I've been doing that a long time. You know, I've got my Synergenics practice, and I see a lot of patients, and I'll be honest, I don't think I've ever received anything but a on my post elite health evaluation questionnaire, all A's basically, because I do my best. It's time consuming and tedious. I'll read you a most recent 5-star review that Synergenics sent me after one of my brand new patients who has a medical degree. Very thorough and complete evaluation. The most involved and detailed physical health assessment I have had in 30 years. I felt the entire staff, especially Dr. Letta, had excellent attention to detail and planned for my health that was focused on optimizing in a complete plan for my physical and mental well-being, rather than just giving me another pill or just waiting for something to break. Cornerstone. In the disease model, we don't even look until you have symptoms of end organ damage, and it's too late. I don't like that model. I'm going to teach you what I know about preventing the likelihood of getting disease so that you don't need to investigate at a later time when there's a real problem. You know, along that same line, I do still do some acute care. I work for some hospitals. I do some urgent care. And you're going to hear me throw the pharmaceutical industry under the bus a lot. And the treatment of chronic disease is a disaster. Okay? A disaster. it doesn't work. People don't live longer because you put them on a bunch of medicine because they have diabetes and high blood pressure and those sort of things. You live longer if you don't have high blood pressure. You live longer if you don't have diabetes. And the solution to that in the vast majority of individuals is what I'm going to teach you if you'll just take the time to listen and learn. Most of you are too lazy. Maybe you won't be this time. One of the facilities I work for did a recent patient satisfaction score, and I did receive, again, go to work, do your best. I did receive a personal note from the CEO that just said, for your information, your individual satisfaction scores were very high, almost entirely 100s. Go to work, do your best. I care about people. If I have to intervene in your life, whether it's in an acute care setting or in my wellness practice, you're going to get everything I got. It's very time consuming. It's hard, but I'm going to do it. So back to the disease model. You know, I was sitting there surfing some websites about life expectancy. And one thing that's dawned on me is, you know, obviously we see our life expectancy extending. And it's kind of odd because if you really think about it, compared to 1960, the population's less healthy, not more healthy. So is that famous pharmaceutical industry the reason for that? Yes and no. If you actually look at it, if you consider life expectancy, it's from birth to death. And infant mortality has declined substantially, okay? And if you start getting rid of people who have zeros factoring into the end result, it's going to look like life expectancy climbs quite a bit. I mean, that makes sense, right? But I actually looked at some graphs of life expectancy from age 65 on in the country, and we're doing a little better there too in the last 10 decades. Now, a lot of that is just explained by simple stuff like refrigeration and antibiotics. Remember, acute medicine. I've jerked plenty of people from the jaws of death in emergency medicine, and I couldn't have done it without the pharmaceutical industry. But I'm going to tell you right now, I don't think our life expectancy is improving, and it's starting to slow down. In fact, from 2015 to now, it's declined. It's not happening because of the management of chronic disease and the disease model. It's a disaster, and if you're going to go down that route, you're going to be on a ton of pills. Your doctor doesn't even understand the drug-drug interactions. God probably barely does. And you're not going to have a great outcome. You want to learn how to not get chronic disease? Listen to me. First and most importantly, understand chronic disease. So here we go. Hope you got some time. I'm going to look at my watch so I don't go too long. All right, I'm not going to give myself more than about another 15 to 20 minutes for this component. Well, I kind of told you chronic disease. We're going to cover everything, at least so you have an understanding, gloss over stuff. I want you to understand what atrial fibrillation is. Rates are going through the roof. In my week here recently, I've seen a couple of patients with atrial fibrillation. I want you to understand high blood pressure. I want you to understand what a heart attack is, what a stroke is. I want you to understand autoimmune diseases. I want you to understand diabetes. I want you to understand what osteoporosis is. I want you to understand all of that stuff. And then I want you to understand how we can follow some of these diseases and markers. And we're going to go through all of that. But I'm going to tell you, well, actually, I'm going to ask you, our body is made up of a bunch of systems, right? We've got your endocrine system makes your hormones. We've got your neurological system, your brain and spinal cord and peripheral nerves. We have your cardiovascular system, your heart and blood vessels. We have your urological system, your kidneys and your bladder. We have your digestive system, liver, pancreas, your mouth, your stomach, your intestines, We have your musculoskeletal system, right? The skeleton and the muscles. Well, what's the most important system? Bet most of you said digestive because you like to eat. Okay, I'm trying to be funny. It's pretty simple. It's the vascular system. Oh, you include your immunological system, okay, fighting infection, cancer. But it's the vascular system because the vascular system keeps every other system alive. And a general statistic, it's generally accepted that about, at least in this country, about 60% of us are going to die of a disease of the vasculature. And the two biggies are stroke and heart attack. So my goal for this remainder of this segment is I want you to understand blood vessel disease, what we understand at the molecular level, and talk a little bit about some of the big endpoints like stroke and heart attack. Probably I'll try to cover high blood pressure. Okay, so obviously, let's just talk about the basics of the vascular system. You have a heart. It's a pump. It pumps blood to the remaining tissues in the body and to itself in order to provide oxygen and nutrients and carry waste away from the tissues after they metabolize those things. And that pump pumps through arteries that go to the tissues, and then the blood is then returned through the heart to the lungs where it's reoxygenated, back to the heart, and then back out to the tissues again, constantly turning over. So the pump is very important, obviously, and the blood vessels themselves are very important. Now, the process of atherosclerosis, which is layman's terms, hardening of the arteries, is that as we age, we deposit fat in the walls of the arteries. And this is happening in the big arteries, like the ones I look at in my evaluations every year, the carotids with ultrasound. And it's happening in smaller arteries, like the coronary arteries, the arteries that actually feed the heart muscle itself, because it has to have its own blood supply, because it's a tissue and it has to stay alive, and it's a high demand metabolic tissue. Okay? And then down to the tiny arteries that eventually turn into capillaries where all the metabolic exchange occurs in the individual tissues. And the process of hardening of the arteries and arterial disease is occurring throughout this system. And when it fails, things start happening that are not good. All of your diseases of aging, osteoporosis is related, dementia is related, decline in your vision, your retinas are getting poor blood flow, and your retina becomes less healthy, and you can't see as well. I can still see 20/13 with my glasses on. Got very healthy retinas, I'm sure. Your muscular system, you start to lose muscle mass because of not just, hormones, but also, you're not getting as good of oxygenation and as good of nutrients to your muscles. Your skeletal system, osteoporosis, osteopenia. It's all linked. So we gotta address the blood vessels. And I would say that it's the biggest cornerstone of the synergenics practice. I mean, I care a lot about your metabolic health, but I gotta look at these things that show me that you're being driven towards advanced cardiovascular disease. And again, in the disease model, it usually goes something like this. My right arm got numb and won't move. And you go get looked at and they look at your carotid artery. It turns out you're blocked off on the left side and you had a stroke. Or I'm having chest pain and trouble breathing. Well, that's because your pump's failing because you blocked an artery that feeds part of the heart muscle. And now that part of the muscle's not contracting anymore. So you've got the heart pumping, but one piece is just sitting there. The pump's less effective. Bad, okay? Now we have excellent technology. Sometimes in the ER setting, I can open that artery up with some drugs provided by the pharmaceutical industry called thrombolytics, and you can go see a cardiologist, a skilled doctor who probably also cares very much about your health, who will insert a catheter and figure out where the blockage is, and there's strategies for opening that artery back up. And sometimes if we get to it quick enough, the muscle may recover, but man, you've let that process go pretty far at that point. And oh, by the way, when you come out the door from that cardiologist after the heart attack, you are going to be on a slew of medicine that they have shown some benefit of long range. But you know what? Scientific evidence says that my lifestyle beats the cardiology meds after the heart attack for reducing future events. Now, a combination may be appropriate. I certainly have patients that are cardiac patients, and I don't tell them get off all your medicines, but I try to enhance the lifestyle prescription. This is what you're going to learn eventually. So, a heart attack, what happens? We're going to talk first about the blood vessel. Okay, so imagine your blood vessel. It's the artery. It's a muscular tube. Okay, it can squeeze, can relax. It has a lining called an endothelium. It's a single cell layer. And there is the propensity for things in your bloodstream to clog that lining. Now, there are really three main driving factors. Small, dense cholesterol particles, which we call LDL cholesterol. And I got lots of them. Genetics, pretty hard to beat. You can take a decent genetic profile and wreck your cholesterol panel, but if you're like me, you can have an optimized lifestyle and not get a perfect cholesterol panel. And the way the disease model addresses this is certain levels you just go on a statin. Now I'm just going to jump ahead when we're going to cover my health in great depth when we're done with this whole series. But I went and got a coronary. My carotids have always been clean with moderately thickened wall, but not bad. I mean, about average for my age. But I don't have any blockages. Very smooth looking, but I didn't know about my heart arteries, and I've been running around with elevated LDLs for 57 years and don't take any medicine. So I went and I got a CT coronary angiogram in December. Nothing. Open arteries, 57 years old. I'm pretty confident I'm not going to die a vascular death, or if I do, I'm going to be really old when it happens. And that's with significant risk factors. So these small LDL particles can contribute, and how they do is they actually penetrate that endothelial lining and get behind it and start to encroach on the width of the blood vessel. And you can just imagine how it worsens and your blood vessels get smaller and smaller, and you've got this pump trying to pump through a narrowed tree, pressures start to increase, high blood pressure. The walls become stiff because this cholesterol, as we call it, that deposits there, thickens and makes the walls of the artery less pliable, so that you start to see increases in systolic and diastolic blood pressure. We know that inflammation, another component, the cholesterol particles and inflammation, okay, are associated with increased deposition of the particles through the wall of the artery and behind it. And then finally, and inflammation is very well demonstrated to be controlled by lifestyle, things like not having any visceral fat, less than half a pound inside my abdominal cavity, okay? Visceral fat's associated with high inflammatory markers. Mine are always perfect, okay? Probably some genetic component too, but lifestyle, I've proven, reducing visceral fat makes these markers go down, okay? So, inflammation, small particles, okay, can penetrate the wall. The wall is inflamed. It's like you're blowing holes in it, okay? And then finally, blood sugar, average blood sugar. If your LDL particles, and this is a really kind of simplistic way to look at it, but it probably holds some water. If your LDL particles are coated with sugar, okay, they're stickier. Let's just look at it like that. So they're more likely to penetrate. This is why we know that diabetics die of the same stuff we all die of. They just get it faster. And and they particularly die of heart disease and stroke at younger ages than the regular population. Okay? So the sugar probably somehow is involved in making the particle stickier and more likely to penetrate the wall and accumulate in the blood vessel wall. Now, eventually, if you accumulate enough fat behind that wall, it forms what's called a plaque. It's kind of like a bump in the wall. It's almost like fat extruding back out through the wall, and it's roughened, and then inflammation is involved again as a trigger for what we call plaque rupture, okay? When a plaque ruptures, your body's clotting system attacks. It's like an injury. And if that clot that forms on that plaque rupture is big enough that it completely blocks the blood flow beyond that in the artery, in that already narrowed artery from all the fat you're depositing from not doing what I'm going to teach you, plus the combination of your genetics, you are going to see a complete obstruction. We call it a thrombus in medicine. And whatever's downstream dies. So when one of those plaques ruptures in your brain, stroke. When one ruptures in your heart, heart attack. Okay? As you accumulate this blood vessel mess throughout your body, your blood pressure's climbing. You know, I run some risk prediction models on my patients to toy with whether to attack their bad cholesterol panels or not with pharmaceutical intervention versus lifestyle only. And if you want to drive up the risk of having a heart attack or stroke in the next 10 years, increasing the cholesterol in the equations does that. You want to really drive it up? Increase your blood pressure. Show me the scientific evidence that says maintaining your blood pressure at a normal level through pharmacology, the treatment of chronic disease, substantially impacts your life expectancy. It doesn't. Having a blood pressure like mine, I follow it pretty regularly. I'll share some of these things with you in a more formal format, probably at my lecture stand with the very primitive, you're seeing what I transmit from my computer onto the screen behind me mechanism, because I don't have the bandwidth to be a great media guy. I'm still looking for that person to reach out and go, Dr. Bob, I want to pair with you. You got the data. I got the skill set there. I've planted the seeds. No traction yet. When that person comes along, I'm teaming up and we're going to town. But in the meantime, all I'm saying is my blood pressure is excellent. Dial up the blood pressure in those equations, cardiovascular risk starts increasing substantially. I've seen documentation that for every 10 millimeters of mercury that your blood pressure goes up, your cardiovascular risk doubles. Risk of a heart attack and stroke doubles. I'm not saying get off your antihypertensives if you have massive hypertension. You may have let this you may have let this horse so far out of the barn it's irretrievable. You know, I'm saying if you don't have hypertension, let me teach you how to not get it. So I think that's a pretty good overview of the most significant chronic disease factor in our lives, which is disease of the blood vessels, atherosclerosis, heart attack, stroke, hypertension. There's other factors that, come into play in the hypertensive world, including, evil humors, some of which are genetically controlled. But I can tell you that lifestyle, proper diet, exercise, visceral fat, quick one, obesity, which we're going to talk about at length when we get to nutrition. I'm going to talk about the diets at length. I'm going to talk about strategies for losing weight that work, that don't involve you starving all the time or exercising at an unsustainable level. But obesity, for every 10 pounds of fat that you lose, your blood pressure comes down 5 millimeters of mercury. Obesity is not a cosmetic disease. It's a metabolic disease. It kills you. It takes away the God-given gift of life. And it breaks my heart when I see it. I have literally become tearful at times when I've seen a person that I know is struggling with obesity, and I think about the trap that they're in. I want to help all of you. I hope some of you will auger in and get ready. We'll keep covering chronic disease. When I get through it all and I'm confident you have a better understanding of the enemy, I will go over how we follow some of these risk markers. This is very important for my patient population. If you're just picking up, somehow you got on my YouTube channel or you follow me on Facebook and you're listening, great. I'd love for you to listen to every lecture I give. It's going to be a long road to hoe. It'll be good for your long-term health. If you're one of my patients, there's going to be a test at annual. You better be listening. I cannot give you all of this in the 6 to 8 hours we spend together during the initial elite health evaluation and the subsequent 4-hour visits that we do annually, and the times that we spend together over the phone reviewing labs as we adjust hormones and use targeted supplementation and hopefully get some lifestyle changes. I can't cover all of this, but here's your opportunity to understand it, listen, get the maximum of my intellectual property. I'm going to work hard. I hope you'll be there with me. God bless you guys. I'm headed home from Cordova today. Looking forward to seeing family, having a little R&R, going to do some skiing tomorrow, get some exercise. Don't forget, lift weights, get some cardiovascular. Don't substitute duration for intensity. But if you can't go intense, getting off the couch is the first step. We're going to cover it all. I can't wait. I'm really happy. I'm done with COVID. I'm going to try to act like it never existed. See you next time.